Hello and welcome to Better Living for Better Health. I'm Melody Nall and I'm the Kentucky Cancer Program Cancer Control Specialist. Last year, the Kentucky Cancer Program and the Regional Cancer Partnership here in the Purchase area brought the colossal colon to town, and we did that so that we would be able to increase awareness about colon cancer. About 7,000 people visited the model of the colon out at Kentucky Oaks Mall. And we were very proud of that because we know that we need to teach people it's okay to talk about your colon. And that might sound funny, but we know that when this cancer is found early, we can save lives. I'd like to start with just a few statistics about colon cancer. Nearly 154,000 people will be diagnosed with this type of cancer, and over 52,000 will die in the United States this year. In Kentucky, we expect nearly 2,600 new cases of colorectal cancer and 860 deaths. I have two very special guests with me today. Both of them have experienced this cancer, and they have, I think, distinctly different stories. And they're very gracious and willing to share their story with us today, not because this is a comfortable thing to do, but because they know that their stories can help other people and save lives. So I'd like to welcome both of you here today. I'd like to introduce Debbi. Debbi Bendel is here. She is a two-time colon cancer survivor, and she will tell us a little bit more in just a moment. Next we have Sue Tilley, and she's here to share with us today. She's a two-time cancer survivor, but her story's a little bit different. She had breast cancer first, and then now, most recently, colon cancer. Sue, welcome. I'm so glad you're here.
Thank you. Glad to be here.
Well, let's just start with Debbi here. I know Debbi and I met actually last year because of the colossal colon, and she's a friend of a breast cancer survivor that I know, actually a next door neighbor.
That's right.
Of a friend of ours, and she recommended you to come out to the colossal colon and work and to share your experience, and you were just wonderful at the mall talking to people, and I appreciate that so much. You have experienced colon cancer twice.
Yes.
So if you wouldn't mind, just tell us about, we'll start with the first diagnosis, and how did you learn or decide to go have some screening?
Well, it wasn't really smart of me. It really wasn't. It was in 1990, and I just started bleeding bad, and I let it go for almost a year. I was scared to death to go to the doctor. It was just it was frightening because I knew something was really wrong, but I didn't want to know what it was, and I just let it go and let it go, and I was getting sicker. So finally, when I went, I had told a doctor, and he said, well, when it gets worse, we'll do something. I didn't want to tell him it was worse. Well, then it got where I just wanted to lay around all the time. So I went back and I told him it's worse. So then he sent me to Dr. Blaylock, and Dr. Blaylock found the cancer. And I'm so fortunate. It was large, but it wasn't fast growing, because he said I would have been dead. Wow. I just let it go. And then the next time that it came was in 2003, and it was fast.
Okay.
And I had no symptoms. I just thought I saw a little bit of blood, and I wasn't even for sure about that. Okay. And I have a friend that's a PA, and she insisted that I go. And if it hadn't been for Retha, I probably wouldn't be here, because it was so fast.
So dramatically different
yes,
cancers.
Totally different.
But they were the same, in the same area of the body, the colon.
The first one I had was as low as it could get.
Okay.
And then the next one was as high.
Okay.
And when they did surgery, they still didn't know if they had gotten it all at the time.
Okay.
But
now, with the first diagnosis, when you were seeing your doctor, and when they found the cancer, what screening test did they do for you?
I had a colonoscopy.
Okay. Okay, which is our gold standard of screening.
Yeah.
We have some others that doctors will sometimes recommend, but we know that colonoscopy lets us see everything that's going on in there.
Well, I had the lower GI, but they didn't see anything.
Okay. Okay.
And that's why they
So-
wanted to do something else.
Yeah, well, you're a perfect example of why
Oh,
that
yes.
colonoscopy is recommended. And then, did you have regular colonoscopies after that, between the two?
Yes.
Okay. And about how frequent were they?
At first it was every year,
Okay.
and then it got to every 3 years.
Okay.
And then when I had the last one that they found cancer, I had about a year. I think it'd been 2 years, and I went on ahead and had it early, and they found it.
Okay. Okay. We're going to talk more about your experience and how you became such an ambassador for talking to people about colon cancer. But I want us to hear from Sue.
Well, to begin with, about 30 years ago, I had breast cancer.
Okay.
And thinking that you've already had breast cancer, there's not likely that I'll have another cancer at all. I'd passed the 5-year program for that. And I had been working with a federally funded program called Kentucky Seniors Saving Medicare for the past 4.5 years. And in my job, I would tell seniors to go get all these tests made that Medicare will pay for, get a colonoscopy. And I'd never had one made myself. So I decided that maybe it's time for me to go get one. My husband had had 2 made and had some polyps, and so I decided to go have a colonoscopy. And when I awoke from my colonoscopy, the nurse said, "Well, you're about 25 years too late." But they found that I was really full of polyps. And if you don't know what a polyp is, if you stick your finger up in a balloon, that's exactly what it looks like, little polyps. And I had a lot of polyps. So they set up the surgery for me to have, and that was a year ago in December. In fact, I was in the hospital on Christmas Day. And they removed half of my colon, and only one of the polyps was malignant. Fortunately, it was not attached to anything else, so I did not have to have chemo or any further treatment. So I was very fortunate with that, and I've had no problems since, none before. I had no symptoms of anything, so I feel very fortunate, and I still go for colonoscopies once a year. I went again in this past December, and I'm doing fine, and he told me to come back, next year, so I feel very good about that. And at the same time they did my colonoscopy, the second doctor also removed one of my ovaries. He was afraid that it might be attached to that, but it wasn't. So I had 2 surgeries in one.
Okay.
So I feel like I'm a real survivor doing the breast cancer and all these years, plus the colon cancer.
Yeah.
And I've always been a good ambassador to tell people what to do. Get all these tests made, that you should go. So
You were good at telling, but
I'm
you
good
just
at
weren't
telling,
good at
and
doing.
now I'm good at doing. So
Good.
it is a worthwhile thing. And I found so many of the doctors, your regular medical doctors, don't urge people to get a colonoscopy. And just like myself, you don't know where to go to get this done. You just, you're just blank because it's all foreign to you. So I think your regular doctors should really put more emphasis on scheduling a colonoscopy for anybody that goes in for just a yearly physical.
Now, I know you were talking to seniors about
Right.
having those tests.
Right.
How did you feel when you were talking to them, knowing that you had not been?
Well, like I say, I just didn't think it would hurt. I had no symptoms of anything, so I thought I'm okay. There's no need for me to have one.
And so that's probably one of our biggest education messages today to share with
Right.
our audience.
I had
that-
no symptoms of anything,
Yeah.
so I thought I'm fine.
Yeah, and we don't want to wait for symptoms, do we, Debbie?
No.
Because those symptoms can
Sure.
sometimes that cancer is already large, and you were fortunate that first
Very,
time because you
very.
had many extreme symptoms, but that cancer was a slow growing cancer. We didn't talk about treatment, so would you mind sharing what kind of treatment that you had besides the surgeries?
Well, the first time they told me that I was going to have a colonoscopy, and that just scared me to death. I did not want it. I kept praying that it wouldn't happen. And the doctor came in and told me, he said they could try radiation. Otherwise, I was having the surgery the next day. And I went for the radiation. So it saved me from that. And then after surgery, then I took radiation.
Okay.
And the next time I didn't have to go. I just went through the chemo. I'm sorry, the chemo the second time. Is that what I said?
Yeah.
Okay.
Chemo the second time. And do you remember how long that chemo lasted?
Not really, but it was a
Okay.
long
Long
time.
time. A long time. And you had to
Yeah.
go through the effects of the chemo and
Oh, yes.
anything you want to share about that?
Well, both times that I took the chemo, they were the same. They told me it was the same thing.
Okay.
But the first time I was so sick. I was just really sick. And the next time they did it different. They said the same thing, but they just do it a little bit different, and I wasn't as sick.
So you could
Much
see an
easier.
improvement from
Absolutely.
1990 until
Big difference.
Yeah, and it was '03, is that right? '03. So you could actually see the increase and the benefits of all the research that's going on at making chemotherapy easier on cancer
Really
patients.
everything, because the first time I was in the hospital for a long time. And the next time I was 1 week, and I couldn't believe it. When they
Yeah.
told me I could go home, I think, I'm not ready. You know, I don't think, so it was, everything was, it's just
Quite a
really
bit-
improved.
quite a
It's-
bit different.
Yes, yes.
That's awesome. That's awesome. I know we've talked about colonoscopies, and both of you found you had some symptoms, but the second time it was because of that colonoscopy. And I know people fear that test. And one of the things, and we'll probably have a graphic in a moment, that test literally will just take a small scope up all the way through the large intestine, which is what we're calling the colon. And we refer to this cancer as colorectal cancer because it involves the cancers that are diagnosed both in the colon and at the very end of the colon is the rectum. And that's where we want to make sure that people know that test, you don't know that you're having the test, do you?
Not
The
at all.
actual test.
Not at all.
No.
Okay.
There's no pain involved.
Okay.
They give you a shot to put you to sleep, which is you're just out for a few minutes because the whole thing doesn't take very long.
Right.
But there's absolutely no pain and nothing afterwards. You drink this liquid to get yourself cleaned out before the day before the test, and then when you go in, there's nothing to it. It's
Right.
just so simple. Everyone should have it done.
So all the
At any
fear-
age. I have 3 sons, and after I had my problem, I urged them to all get a colonoscopy, and they have done that.
Good.
And they were all okay, but they range from 40 to 50 years old, and I just think that everyone should have it done. If there's any cancer in their family, they should have it done, I would say, starting at least by 40.
Okay. Well, the guidelines are starting at 50 unless someone has it in their family, and they do start earlier, and we ask them to talk to their physician about that as well. So I just wanted to hear both of you say that the colonoscopy is not painful. You
No.
don't know what you're going through because that is the fear. You know, when I started the show, I said we wanted to make this a cancer, or that we could, not even the cancer, but a part of our body that we could talk about. And this is a test that we need to talk about. And people just like you who have experienced this cancer are the ones who can do that best, and I appreciate you being here so much. We are going to take a break here for just a moment and share some information on the screen that you can read, and we'll be back in just a minute. Welcome back to Better Living for Better Health. I'm Melody Nall, and my guests today are Sue Tilley and Debbi Bendel, and we've been talking about colon cancer and their experiences. And I want us to continue and really kind of talk about the personal side, because I know when you get that diagnosis, when anyone hears cancer, we all have a reaction. So I would like to know, and I know it may be tough, but what was your reaction when you heard that diagnosis? Either one of you.
Oh, I cried. I cried a lot that day. And it was like, I couldn't believe it because my kids were young. And then I prayed, and when I prayed, it was, the calmness came over me. And I never was like that again.
Okay. So your
Yes.
faith was
Oh,
able
yeah.
to alleviate those fears. How old were your children when you were diagnosed?
I had, let's see, I think Chance might have been kindergarten.
Oh.
And then Chad was 3rd grade. And my husband was the one that had told them. And it was the youngest one, he took it the hardest because he didn't want to go to school. He didn't want to leave me.
Yeah. What was their understanding of what was going on, or how did you explain that to them?
We just told him that Mommy was sick and that, I would get better,
Okay.
but it was going to take a while. And my youngest one, bless his heart, he just, like a little leech.
Wanted to be close to Mom.
Oh, yeah. He
Yeah.
wanted to do everything he could.
Yeah.
He wanted to cook, which he couldn't cook.
Yeah. And your husband, how did he help and support, or how did he react to that diagnosis?
Well, he added a deck on that we sure didn't need. I didn't know what he was doing. He said that was his way of coping.
He had to work.
Yeah, put something on we didn't need.
Yeah.
But
Okay.
we all made it through it.
Yeah. And then the boys were older the second time. And did they share how they felt when they heard it again?
No, I really don't. They kept it more to themselves. They stayed with me. They stayed at the hospital at night, a few nights with me. But I could tell that it really upset them,
Sure.
but we made it.
Absolutely. And that, I think, knowing that we have family and friends that support us during these times, I know that's what gets us through, whether it's cancer or heart disease or whatever the illness may be. So, Sue, let's talk about you, and how did you react when you heard that word, cancer?
I'm going to have to say, when I had the breast cancer, I was much younger. I had 3 children at home, and I just prayed to God I could get back home and raise them to be grown, which I did. By the time the colon cancer came around, I think I'd talked to so many people because I used to do a lot of work with the Reach to Recovery program.
Okay.
And then I was doing this program with the senior citizens. I think I was pretty brave about it. Of course, my children were all grown. I have 6 grandchildren, so I was not afraid. I was just hoping that it would not be something I would have to have a lot of chemo. If I did, I think they made such progress now that I really was not afraid of anything. It was just something you go through.
Okay.
And I think they made a lot of changes in the way people are treated, and the way that the treatments are just not as severe as they used to be. And I was not afraid, but it was just something I had to do. And I was off. I was in the hospital for 9 days, and of course all the family rallied around and everything. And I've had good support. And I went back to work then after about a month, I think. And that helps too, to have something to do.
Now, did you continue in that position where you were talking to seniors
Yes.
about the
Up
screenings?
until last July is when I quit.
Okay.
And
So you had a personal story you could
I did.
share.
I could tell them and urge them to go, and I think it did help. I feel like that it was a wonderful program. It is a wonderful program, and I think it helps to tell seniors all these programs, the preventive medicines that are available, and they should take advantage of it.
Yeah.
Especially the colonoscopy
Absolutely.
after that.
Absolutely. I know we talk about prevention, and a lot of people will ask us, well, what can I do to prevent this cancer? And last year during our big display, we did talk a lot about prevention, and of course eating fruits and vegetables and having more whole grains in our diet, getting exercise, keeping our weight at a good spot for our body. Have you, either one of you, changed your lifestyles as a result of the cancer, or things that you're doing differently now?
really, I haven't.
Okay. Were you doing all those things already?
I don't know. It's just I haven't really changed. I know I should,
Okay.
but I haven't.
Okay.
I don't think that I've changed anything, but I think I'm more aware of eating the right things, not to keep from getting cancer, but just for general health. I think we're just more aware of eating the right things and getting exercise and things that we need to do to take care of our bodies because we're in charge of it.
Right. We're our first primary caregiver.
Right.
It's for what we do for ourselves. Debbi, when we met for the very first time, you were actually working at a pharmacy here in town, and I know when we spoke on the phone, you said, well, I tell everybody they need to have their colonoscopy. So I want you to share with us, what do you tell people when they talk to you about colon cancer and getting screened?
Don't mess around. Don't. I mean, I just feel so fortunate to be here. And the thought of people being like me and being scared and not wanting to take care of themselves, go find out what's wrong with them, it really bothers me. I don't want this to happen to anybody else.
Absolutely.
Be smarter than me. You know?
Yeah.
Take charge.
Have you thought back on that time and wondered why was it just the fear of,
Oh, yeah.
okay.
Oh, yeah.
Because waiting a year or more with symptoms, it just sounds.
Yeah, it was nuts. It really was nuts. I mean, I really felt this is what was wrong, and I didn't want to go find out.
Yeah. And now we know that if people just go have their colonoscopies, find those polyps, remove them early,
Right.
then really they don't have to worry about this cancer.
Most of those polyps, I think, are real slow growing, and if you catch those in the early process, then you could avoid all these treatments that she had to have because they are slow growing, and even if you have a bunch of them, like I did, with them being slow growing, I only had the one that was actually cancerous.
Absolutely.
So if you catch those early, you can avoid a lot of treatments like Debbi had to have.
Absolutely. I know sitting here and we're talking about colons and we're talking about polyps, but these are really life-saving messages.
Absolutely.
And I know both of you have
True.
ventured through this journey for a while now. Sue, what do you say to people? I know you're not working now, but you
I'm not,
probably have a
but
chance to.
I still have a lot of contacts. People still ask me about their Medicare and what have you. I just urge them to get the test. You just can't urge people enough because, in the first place, if they're on Medicare, Medicare pays for all these tests. It's not going to cost them a thing. And it's just foolish not to take advantage of it. And, of course, if they're on other insurance, everyone has some kind of insurance, and it will take care of their cost if they're afraid of that. But since there's absolutely no pain, and you've got everything to gain, it's just foolish not to have it done. And that's what I urge people. If you haven't had one done, go do it.
Okay. What about family members, Debbi? Sue mentioned that she talked to her sons and encouraged them to go. Are you an advocate with your family members as well?
I have told them because my mom and dad both had cancer twice. Not what I had, but they had it. So I have definitely, I don't want them to mess around.
Have they been?
No, they're both like in their 20s, so I haven't been as worried about it.
Okay. But having those dialogues with them that because cancer has been in their family and they will need to be screened earlier than the recommended guidelines,
Definitely.
they'll know that. I know Debbi will tell them to go. And that's awesome. That's awesome. Any other thoughts that you can think of today that you would want to share about your cancer experience, the time either with family and friends that was important to you? Can you think of a situation or something that was especially special? You know, maybe someone reached out to you that meant a lot to you that you want to share with us today.
Well, when I went to have after I had my colonoscopy and knew that one of the cells was malignant, our church rallied around and prayed. We did a lot of praying.
Yeah. We do that, don't we?
Yeah, it pulls you through.
Absolutely. Our faith can carry us through. Yeah. Debbie?
Oh, my church was definitely, they were there for me. And after I had gotten home from surgery, they brought food to me every day, or like every other day for a month. I mean, they were there for me. I couldn't ask for better people. And they just really helped me get through it.
Yeah. So our family, our friends, our churches,
Right.
they help us get through the tough times.
Oh,
Well, I'm going
yes.
to tell you something. You two ladies are very brave, and I appreciate you so much for being here today and sharing your stories, because I know this is a life-saving message. March is Colorectal Cancer Awareness Month, and that's nationwide. And so every March we do step up our messages in the community. And I know a lot of people have seen Katie Couric on TV and seeing her colon. But what we want to do locally is to share personal stories. And both of you have done that. They're different stories of how you dealt and how you found your colon cancer. But I just appreciate so much you being here today.
Well, thank you.
Thank
Just
you.
one person could be saved would be great.
I agree with you. Thank you so much. I thank you for joining me here today on Better Living for Better Health. Colon cancer is the second leading cancer cause of death in Kentucky. We can change that by having regular colonoscopies, by making sure that we don't wait until we have symptoms. We can change that statistic. We want you to make sure that you're doing the prevention steps that were shown on your screen earlier, but we really want you to have those colonoscopies. I appreciate you joining me here today, and we'll see you again on Better Living for Better Health.